As a kid, Dexter Grant always attended his annual health screening, a yearly appointment to stay on top of your well being. It's a chance for your doctor to monitor certain variables like reflexes and blood pressure. Health screenings should be a lifelong commitment, but are often ignored by people like Grant, who stopped going to appointments after he left for college. As time flew by, suddenly Grant was in his 30s and hadn't gotten a screening in 15 years.
At first, you're young, you think you're invincible, everything's fine. But then as time gets older, it really becomes fear. You're afraid that it's been so long that you've been to the doctor that something may be going on a more serious level that you're afraid to confront.
And Grant's not the only one who feels this way. Orlando Health recently sponsored a national survey that found 33% of men don't think they need an annual health screening. In fact, nearly 2/3 of men feel as though they're healthier than their peers.
That was one of the reasons why many men did not go to see the physician. But statistically, it's actually impossible for the majority of men to be healthier than the majority of men. So that just certainly can't be true.
That's Dr. Thomas Kelley, a family medicine physician with Orlando Health Physician Associates. He says research shows that men take care of their pets' health more than their own.
Unfortunately, I think men are taught in many cases as they're raised that admitting to illness is a sign of weakness, and that being diagnosed with a medical condition or having to take medication indicates that there is something wrong, and that would be viewed as negative by society.
Kelley also thinks a sense of fear plays a big role in why men aren't keeping up with their health.
I see many men who've come in for their first time seeing a doctor in 5 years, 10 years, or longer, and they just have absolutely no idea what to expect. They think certain things are going to be done to them that they don't want to have done, or that certain demands will be made for specific tests, et cetera. And what I think it's important to understand when a man goes to see a physician is that that's a partnership between the patient and the doctor. It's not a dictatorship for the doctor to tell the patient, you must do this and you must do that.
According to Kelley, a doctor's role is to explain what's happening in a patient's body and then discuss what can be done to fix any issues. He says patients always have a choice on how to proceed.
Almost all of the time after we've completed one of these evaluations, typically the patient will say, wow, that really wasn't nearly as bad as I thought it was going to be. And often we can identify or help with a couple of issues that might have been kind of nagging the patient for a while that they didn't really even realize there was a special treatment for. So a lot of advantages to going and seeing a physician for a routine checkup.
But if someone's feeling fine, why do they need to go to the doctor? Well, what you may not know is that family medicine is all about preventive care. These doctors identify potential risk factors so they can be reduced before causing harm.
So for instance, a person might have high blood pressure. They may have absolutely no symptoms of that high blood pressure whatsoever, but if it were left undetected over a period of time, that can damage the kidneys, it can damage the heart, it can lead to heart attacks and strokes and a pretty significant amount of disability. And in fact, for that reason, they call high blood pressure the silent killer.
But conditions like high blood pressure can be caught early and dealt with before becoming life-threatening. Kelley says it's important to realize that certain conditions may not have symptoms you can catch on your own.
Certain types of cancers that can be screened for, certainly things like diabetes and high cholesterol. Again, these are conditions that have no symptoms of any kind in the early stages, but left untreated can cause a lot of problems for patients in years down the road. So investing a little bit of time and energy with a physician on the front end can certainly save a lot of heartache and expense, quite honestly, on the back end of things.
Which is what ultimately helped to change Grant's mind. He made his first health screening appointment in 15 years last spring. Grant realized if he didn't overcome his fears, he'd always make an excuse not to go.
I thought everything was wrong because you never know. But when you go and you actually get it done, you get your blood work back, you're like, oh, wow, like everything's fine. And then you actually have a greater confidence. I felt I had a greater confidence in moving through life after the fact because I now had a bill of health.
And even with his health now in check, Grant still understands the fear that can hold other men back, the worry that they'll be forced into an uncomfortable situation.
I saw a patient today in that exact situation who came in for his first physical in many years. He was just turning 40, and he said, one of the reasons I put this off was I was worried about having a prostate exam. And he did not realize that that's not always a standard part of a physical examination. In fact, that's a discussion that should take place between the doctor and the patient before it ever happens. And many times it may not be indicated. So he prevented going to the doctor for a number of years for something that he didn't even need to be worried about.
But what if the fear proves to be right? Not everyone who goes in for a checkup will leave completely healthy. What if doctors do find something wrong? Kelley says that's like finding a fire in your basement, then shutting the door and hoping it goes away. If left alone, that fire's only going to grow.
And when we do that with our health, it can have the same consequences. The house can burn down from underneath our feet before we have a chance to do anything about it. So fearing that something is going to be found does not make that thing go away. It just causes that thing to be found at a later time when it's more difficult to treat. It will be more costly and perhaps cause more challenges for the patient's long-term health. So it's a very understandable fear of, gee, if I go and they find something wrong with me, that would be awful. But quite honestly, it's much more awful to delay finding out that there's something wrong.
Even certain cancers can be completely cured when found in the early stages. Unfortunately, Kelley says that once the disease progresses, it can be difficult to manage and even become fatal. But even with all of this information public, men still aren't making their appointments. So what will get them to take their health seriously? Kelley says it starts with the medical community doing a better job of targeting information towards men.
I think one of the maybe special reasons why men are a little different is that women often have their own unique physician to deal with their women's healthcare needs, an obstetrician gynecologist. Men don't have that specific type of physician. So it's really their primary care physician. And I think that might be another reason why women are a little bit more of the mindset of going to see their OBGYN on a recurring basis. And I think we've done well as a medical community of getting that word out. I don't think we've done as well getting the word out to men that there are equally important issues that need to be addressed in a man's routine healthcare.
And as the medical community works on informing the male population, Grant thinks men should start having these conversations with their friends.
I think it's important that as men, in our talks that we normally have, whether that's sports or whatever have you, we include health in that and just saying, hey, yeah, when's your last checkup or when you're going to go again? And, holding each other accountable. It's unfair to those who love you and those you're surrounded by to not be able to enjoy you at your best as long as they can because you failed to go into the doctor.
You can find more information about Dr. Thomas Kelley and Dexter Grant on our website, radiohealthjournal.org. For more behind the scenes, follow Radio Health Journal on Facebook, Twitter, and Instagram. Our writer-producer is Kristen Farah. Our production manager is Jason Dickey. I'm Nancy Benson. Coming up next week on Radio Health Journal.
Looking in the mirror and not recognizing yourself is very painful and a very strange feeling.
When losing your hair feels like losing your sense of identity.
Then can we end the HIV epidemic by 2030?
Those who have been diagnosed with HIV are living much longer, to the overall rates of HIV coming significantly down.
All that and more on Radio Health Journal. I'm Reed Pence, the producer and host of Radio Health Journal. If you like listening to Radio Health Journal, you'll also like our sister show, Viewpoints, which covers a wide array of topics from education to history to the environment. Here's a preview of what they're covering this week on Viewpoints.
You can tell where the village ends and the resort starts because that's where you start to see palm trees.
Understanding the fallout from fast-expanding beach resorts. Then,
is it fruity or is it something else first? I think that does an enormous amount for grounding you in what to expect from the wine.
Diving into the study of wine, a beverage that dates back to 6000 BC. I'm Marty Peterson.
And I'm Gary Price. These stories in depth this week on your public affairs magazine, Viewpoints.
Listen to Radio Health Journal and Viewpoints on your favorite radio station. And subscribe and listen anytime on Apple Podcasts, Google Play, and Spotify. Also, follow us on Instagram and Twitter at Radio Health Journal.
And that's Radio Health Journal for this week. Follow us on Twitter, Facebook, and Instagram to learn more, and check Apple Podcasts, Google Play, and Spotify for a library of past programs. Plus, you'll always find previous segments and information about our guests at radiohealthjournal.org. Join us again next week for another edition of Radio Health Journal.